In this technique, I'm going to show you a few variations. I'm going to start using immobilization, and then we're going to go into a soft tissue technique, and then we're going to go into a mobilization for the ribs. So what we can do is place your hand onto the lower back and just use like a rocking motion. And then this hand, the fingers can palpate the spinous processes. So you can literally just utilize motion using the hand to rock and then palpating the spinous processes. And with experience, you should be able to ascertain if segments are working or not. You can also use your thumb and just encourage like a lateral glides of the spinous processes. So I'm literally just almost like counter rotating as I'm coming through in here. And then what I do then is continue with a rocking motion, but using my healer hand onto the soft tissues. And I'm going to use my hand on the lumbar spine and then just transverse across the erector muscles. Okay, but still almost like maintaining like a rocking motion. Okay, so you can go up as far as you perceive, okay, would be of benefit. As in, you know, if you think it's only the lumbar spine you want to treat, that's fine. But it's quite nice to do the majority of the spinal level. Okay, even coming up towards like the base of the neck sort of area in here. Okay, and you spend a few minutes just performing some soft tissue technique. Don't need any oils or any creams for this one. And then I typically will walk around and do the same on the other side. Now, from there, excuse my hand here, okay? So I'm going to place my hand onto the anterior superior iliac spine, almost on here, okay? Almost like a climbing hold, if you like, so I can grip onto it. But I can slowly pull the patient's pelvis to me, so I can pull. And then as I'm pulling, I can then use this hand onto the soft tissues and then just mobilize the pelvis into the lumbar spine, and then I can mobilize through into the thoracic spine. Okay, so I can do these lovely little techniques. Now, to take it a stage further, you want to bring your hand away from the central spinous process and come over towards the angle of a rib over here. Okay, and then if I'm going to mobilize the angle of the rib, which will affect the costo-transverse junctions, ideally I'm going to mobilize towards the axilla. Now, take a small breath in, please. So the patient breathes in, and as they breathe out, I'm going to pull, I'm going to push, and I'm going to mobilize. Okay, if there's already a cavitation, take a breath in, please. And as she breathes out, I'm going to push and mobilize through. If I do a thrust, it's a lock and a thrust down and a lovely little cavitation just here. Okay, so and then I can walk around and do the same on the other side. But try and do it always with the out breath. And that's how you'd perform a few variation techniques for the thoracic spine, for lumbar spine, pelvis, and also the rib cage.